Can you tell us a little bit about what this has been like? I know you have a busy, stressful job in the best of times. What has this pandemic been like for you and your colleagues?
This pandemic's been very challenging. I work in the emergency department where we're used to things coming in very quickly and having to be prepared for whatever rolls through our doors. And I think with the COVID-19 pandemic, we found ourselves not quite prepared for, what we were getting into.
Yeah. How do you feel things are prepared now? We're working in Washington. We've passed another bill, the HEROES Act. And one of our focuses is really on helping our frontline workers, just like you, have the PPE they need and moving to those testing and tracing programs. Are you able to get the protective equipment that you need to do your job?
I, have been saying from the beginning of my nursing career that I'm not able to do my job as a nurse without my entire healthcare team, which ranges from the CNAs and the housekeepers in our hospital to the home care workers and the PCAs that are going into people's homes before and after their hospital stays to help keep them well and healthy. They're struggling in the community with their PPE and having the proper equipment to help take care of our patients.
How has it been for the families that you've been in touch with? We've heard so many sad stories of people, being hospitalized alone and even dying alone. What have you seen?
It's a big change. I mean, it's a huge change. We've, for the sake of public safety and trying to limit the spread of COVID, we've had to really reduce our number of visitors for every hospital encounter. So it's hard to tell somebody that, is coming into the emergency room that doesn't feel well or is worried that they might get worse, that their family member has to, stay outside or go home and that we'll call them by phone. It's definitely very challenging. I work in one of our ICUs. There's a group of nurses that work up there, and they've really experienced it firsthand with trying to manage Zoom calls and FaceTime calls and, using iPads. And they invested in a color printer to be able to print out e-photos of family members so that they could put them in the patient's rooms for them. It's challenging. It's not how anybody wants to spend their time sick or their time at their end of their life.
Yeah, it is. It's been so tough. And we're so grateful to the frontline workers like you. And one of the provisions we have in the HEROES Act is around hazard pay. You mentioned home health care workers and other parts of the team. What kind of difference do you think that would make the ability to get some hazard pay for this, what's very dangerous work?
Yeah, I mean, I think it would make a huge difference for so many families. There are a lot of healthcare workers in Massachusetts that are underpaid as it is for the work that they do. And, for them, we hear stories about their spouse or significant other is laid off and they're the only source of income. So they have to continue to, try to work as many hours as they possibly can, which is stretching them thin and, making them more tired and more susceptible to becoming sick. And then if they do become sick, they have to try to use their earned time or, their own personal time, if they have any, to still try to maintain an income for their family while they are sick.
As you look ahead, if we are not able to get the HEROES Act through the Senate and signed by the president and get the additional funding for the testing programs we need and support for frontline workers, what do you see happening to public health in Massachusetts and across the country?
I'm worried for public health and everybody's well-being and safety if we can't get the HEROES Act passed fully. It's a resource that we need to be able to provide, testing and tracing and PPE and, support for our frontline workers and, the financial support that they need if they do get sick and they are out of work. With COVID-19 or, any other repercussions that come from this virus spreading so rapidly, I am concerned about them for sure.
Yeah. Yeah, I am too. I think it's, we have to act with urgency. We are all worried about our economic health and people losing jobs and having trouble feeding their families and making rent and mortgage payments. But it is completely tied to our public health. And I think there's been a lack of public health investment, and now is the time. We hope that we can tell the story that Boston Medical Center has been able to tell, that everyone can respond like you, that I have the PPE I need, but we need it for the whole team, as you said.